Welcome to the Lunch and Learn with Dr. Barry. This is episode 17.
Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to the Lunch and Learn with Dr. Barry. Today we're going to be talking about sleep apnea. And like always, if you want today's show notes, please go to drpierresblog.com/LLP017. Again, if you want today's show note on sleep apnea, please go to drpierresblog.com/LLP017. And today we're going to be talking about sleep apnea. I'm going to go over signs and symptoms that you may be dealing with sleep apnea and some treatment options that can help. I know a lot of us know about one of the main ones, but we're going to talk about some others in that standpoint. And I'm also going to talk about why sleep apnea is so important to treat. Like it does not have only to do with your sleep. There's so many things that can become a problem if we don't treat the sleep apnea. So stay tuned for another great episode. Today we're going to be talking about sleep apnea, something that I deal with, especially in my practice, quite often, just for the amount of patients who either, have a lot of symptoms that are really pointing to sleep apnea but don't even really know it, and ones who already come in, been diagnosed kind of first and foremost. So what I wanted to do is kind of go through some symptoms that, you may be experiencing. Hey, Amanda, how are you doing? We're talking about sleep apnea today. I want to go through 5, things to look for your patients, for, someone who may be dealing with sleep apnea, especially if a lot of you haven't been diagnosed like officially, and, kind of what to do next, and, why, treating sleep apnea is so important. So number one, we're going to talk about sleep apnea. What is some number one sign and symptom? Snoring. So snoring is, and we're not talking about, just kind of regular snoring, like very loud, excessive snoring to the point where, you affect people down in a different room, to the point where your partner has to kind of sleep in a different bed. And I do have a lot of patients and families who kind of have that kind of arrangement because one partner sleeps so loud, snores so loud that if they don't fall asleep before them, they can't fall asleep. So they end up either going to sleep in a different room or the separate beds. But snoring is a very, very common sign and, risk factor for sleep apnea. So anytime you take any sleep apnea test, that's one of the questions we always ask, like, how much snoring do you do? Number two, first and foremost, sleep studies. Yep, exactly. Sleep studies are definitive tests for diagnosing sleep apnea. And there's a couple, I actually talk about it at the end, but there's a couple ways to do it. I think we know of the official one where we kind of go to a different lab and, have all these things kind of connected to us. But there, it's getting better where we're actually having home sleep studies as well, to kind of diagnose sleep apnea right and foremost. So number one, we talked about snoring being a big risk factor for sleep apnea. Number two is, if you ever notice you waking up, very fatigued, like you had, a quote unquote great night's sleep. You're in your bed for 8 hours, but you're waking up and you're still like fatigued and not really, not really having energy, to kind of go about your day. That's also a risk factor as well for sleep apnea. So a lot of daytime excessive fatigue is another sign and symptom that we get worried about. And number three, for people who, especially if you have a partner who can actually watch you, if you've ever had any episodes where like you stop breathing, where you look at your partner and nothing's happening, and then after a couple seconds their body kind of jerks themselves and then kind of wakes them up, and then they take a like a big gasping breath, and then they kind of go right back to sleep. A lot of times these people never actually fully wake up. It's that their body just says like, hey, you know what? This person has stopped breathing for like 20 seconds. Like wake them up for a second just so they can, take a deep breath in, kind of exhale out, and then they go right back to sleep. So if you've ever noticed, any of your family members, or even if someone's told you yourself that they witnessed that you stopped breathing, that's a big sign and a big risk factor for, being sleep apnea. Number four, Number 4, we talked about if you ever noticed any signs of like where you were like choking while you were sleeping, choking, gasping for air, like during sleep. You may not do that full deep, that deep breathing, or you may not like fully stop breathing like some people do with sleep apnea. But if you witness like a person kind of choking, or kind of feeling like they're having to grasp for air while they're sleeping when they should be, as comfortable as to be, that's also a risk factor as well for sleep apnea. So those are, that's another risk factor that I get really concerned about, when a patient tells me, that, they witnessed their husband or wife, brother, somebody, chokes during their sleep. So that's definitely that kind of, puts a light bulb in my head to think, I really think this person may be having sleep apnea. Number 5, a very common thing is like very common morning headaches. Like every single morning they're waking up with a headache. That's also, it's not a huge risk factor because, morning headaches could be, a few things, but morning headaches is a big thing that I like to think about if a patient tells me like, every morning I'm waking up with a headache. And reason being is that when your body, especially with sleep apnea is pretty much your body going through periods of time where you have kind of no oxygen in your system. So it's no oxygen's kind of getting to the brain. And this happens repeatedly over and over and over throughout the night. So if you have some patients when, especially as severe apneic patients, they go through, minutes, hours, throughout an 8-hour period where their oxygen levels aren't sufficient to kind of keep up with demand. So when you wake up in the morning, a lot of times you end up getting sleep apneic. And hey, Jackie, how you doing? Thank you for sharing. You end up getting headaches when you wake up in the morning. So let's go through the first 5 that we talked about. And there's a few more, but like these are 5 I like to ask, especially when I'm concerned about sleep apneic. One, like, are you like a really bad snorer? Again, not just like a regular snoring. I'm talking about one that kind of clears the room, one that people hear you across, 2-3 different rooms, one where your partner has to like either sleep in a different bed or, go to sleep before you, or they can't go to sleep, that type of snoring. Are you that? So that's number 1. Number 2, are you the type that will stop breathing in the middle of the night? Like you'll see your family member, you see your partner, and they'll just stop breathing for like 10 seconds and then do like a big gasp in air. That's another a risk factor for sleep apnea. Number 3, we talked about the choking sensation, where you have this choking sensation where you're even though you may not have those periods where you stop breathing, but you're having this sensation where like you're trying to catch your breath throughout the night. And sometimes it depends on position, especially if I have a lot of people who like lay on their back. They really experience that symptom a lot more than most people who don't. Number 4, we talked about, you waking up, you had 8 hours of good sleep, and then you're still fatigued. You're still tired throughout the day. You still having, sometimes you're even like falling asleep almost at the wheel, because you're so tired. Even though you had a good night's sleep, there's no excuse for you to be tired, but you're still waking up tired. That's a risk factor as well for sleep apnea. So that's something I like to, be very mindful on. And then the 5th one, again, which isn't like severe, but it's something I always ask, is are you having any issues with like morning headaches? Like if you're waking up with headaches on a consistent basis over and over and over again, we definitely want to make sure sleep apnea is not a concern for you, because again, that is definitely a risk factor, especially if your body's going through these long periods of time where your oxygen level just isn't there. Hey, Dr. Tamika, thank you for joining. Dr. Tamika, we're talking about sleep apnea. We went through the 5 common signs that I like to ask, especially in my patients for sleep apnea. So we talked about we'll go through again with number 1, really loud snorers. Number 2, people who go through periods throughout the night, and it could be 10 seconds, 30 seconds, whatever, where they stop breathing, where you look at them, looking at the body, and like nothing's moving. Number 2, we talked about people who like choke like while they're sleeping, or grasp for air while they're sleeping. Number 3, notice that was 3. Number 4, we talked about morning headaches, a lot of morning headaches. Number 5, we talked about this excessive fatigue during the day. Oh, very good point. So narcolepsy, that's a very good point, because narcolepsy isn't a necessary due to the oxygen level. So narcoleptic patients, they could have a great night's sleep, they could have no excessive fatigue, and then all of a sudden, boom, like they're out. And that's more of a chemical imbalance, a neurological issue more than the sleep apnea, where we're concerned more of an oxygen requirement or oxygen deficiency in that point. But very good question, especially because when we talk about narcolepsy, when we talk about sleep apnea, there's definitely two different ways that we treat it. My narcoleptic patients, we actually give them stimulant medications to kind of keep them up. Like I have a couple patients in my practice with that. We actually give them medications to, keep their mind, firing, because sometimes all it takes is that little lull period, and then they're out, they're sleeping. And it can happen anywhere. They could be driving, they could be walking, it can happen anywhere, and the problems arise. But for sleep apneic patients, they tend to have like daytime fatigue where they're just kind of drowsy. They're just kind of just getting throughout the day. And again, these are the people who get a good night's sleep and it still doesn't seem to matter for them. So as an internist, why is it important to, for me to even be worried about sleep apnea? Because we know, especially from the medicine standpoint, that if you have sleep apnea, like I have a much more difficult time getting you to lose weight. I have a much more difficult time getting you to control your blood pressure. Much more difficult time getting you to control your diabetes. I know that if I don't do anything about your sleep apnea, you're at a more increased risk to get heart disease. You're at an increased risk to get seizures. Because again, seizures, especially if you're going through long periods of time when your oxygen levels aren't adequate, seizure risk increases twofold. Irregular heart rhythms. Again, if you're having, long periods of time throughout the night where your oxygen levels are, not sufficient for your body's demand, your heart will actually go into an irregular rhythm. I think during residency, probably my most, poignant example, during residency, we had a patient who came in who had like a third degree heart block, which again, you don't really need to know what third degree heart block is, just know it's not a good heart rhythm. And, while this patient was sleeping, because we're looking at him on the monitor, while this patient is sleeping, this person goes into this irregular heart rhythm. And we're like, oh, wow, so we go to Ren and we thinking something's happening, and he's just asleep. And then we go to wake him up, and, heart rhythm goes right back to normal. And this was happening, repeatedly. So we end up having to put a pacemaker in him. So again, this isn't a disease that's, without, risk factors. This is something, especially, it kind of seems innocuous, but it is definitely something that, we definitely want to make sure that we're, asking the questions. We definitely want to make sure that we're being as diligent as possible, because we know that the risk factors are there. From that standpoint. So again, I just wanted to kind of touch base, because I think we talked about, sleep habits like a couple episodes ago. So I definitely wanted to kind of hit home sleep apnea, especially because I think, if you're familiar with worldstar.com, Worldstar Hip Hop, I think the website's called, one the founder actually died in his sleep. And, they were concerned for heart disease. But the second I saw, I saw his body habitus, because risk factors for sleep apnea. One, if you're a male, so being a male puts you at a greater risk for having sleep apnea. Two, being, obese. So a BMI, I think of over 35 is what the guidelines are saying now. So if you're obese, a greater risk factor. Again, not to say skinny people can't have it. I want to make sure we get that out the way. Skinny people can definitely have sleep apnea, but you are at increased risk if you are obese. 3, the age. So if you're, I think, over the age of 55, you're at an increased risk for having sleep apnea. Again, this is regardless of weight and exercise and everything else from that standpoint there. And then you're also your neck size. I measure the neck size, especially when I'm concerned, but I usually kind of let my sleep medicine people do that, because we know the neck size plays a risk factor as well as far as patients, having sleep apnea. There's apnea running in families. It does not, because especially most of the most common form of apnea is obstructive in nature. So a lot of it is just a very anatomically, if you're not blessed in that way, anatomically, you can have some restriction in the breathing. So it doesn't run in families. But what tends to run in families is those risk factors, in terms of obesity, large necks, male. So that's where we kind of get that, that family correlation. But it doesn't necessarily run into families in that regards.
Thank you for listening to this episode of the Lunch and Learn with Dr. Barry. If you want to find out more about the episode, please go to www.lunchlearnpod.com. That's www.lunchlearnpod.com for the show notes and any links that may have been mentioned in today's episode. If you're interested in joining the Lunch Learn Pod community, head over to either the website lunchlearnpod.com, or join us on Facebook and Twitter with the same username, LunchLearnPod. And again, you can find all of these links on the website. If you have any questions, any comments, or any requests for topics to, debut on the show, please let that be known. And don't forget to use the hashtag LunchLearnPod when you're listening to the episode. Again, I want to thank you for taking the time to listen to today's episode, and I'll see you next week.